How's it going, guys? We have a pass level question for Obgyn for 2CK for studying for step 1. This type of question is known to show up on the exam as per feedback I have received, okay? So this will be difficult if you're studying for step 1. If you're studying for step 2, you instantaneously know the answer. You think this is too easy. So before we start, please subscribe to my channel. I really appreciate it. Give you a like. Really appreciate it. Find me on Instagram, Mehlmanmedical, MEHL_medical. Links down below. Find me on Telegram. Links to the Telegram group channel down below. Let's start the clip. 38-year-old woman, G4P3, 39 weeks gestation, non-stress test is shown. You say, no fucking idea what this means or what this graph is showing us. I'll tell you. So this upper curve is showing us fetal heart rate. Okay, so it should be 110 to 160. Bottom curve is showing us uterine contractions. You don't have to worry about the numbers. So you can see here that even if you don't know what you're looking at, you can see that you have a relatively straight line, and then there's two moments when the fetal heart rate appears to go up transiently and then come back down. That's called an acceleration, okay? If we were to take this upper curve and just mirror it, flip it over the x-axis where these go down instead, we have transient moments of bradycardia. We call those decelerations, okay? So questions asking most likely explanation for these findings for the non-stress test. Should I say fetal head compression? Wrong fucking answer. So this is benign. You need to know that we're going to have what are referred to as early decels, early decelerations, where we're going to have a dip in the fetal heart rate. Okay, so it's going to look exactly like this, just flipped over the x-axis. So we're going to have a dip in the fetal heart rate at the same exact moment as we have a uterine contraction. So this curve up top, okay? If you were to take this curve and just bring it to the bottom here where you have uterine contraction, it would occur at the same exact moment as a dip in the fetal heart rate. They're in the exact same y-axis. That's called an early decel. Okay, so it's just fetal head compression. USMLE wants you to know it's due to vagal outflow, okay, in response to compression of the fetal head. Wrong fucking answer. Just fetal hypoxia, wrong fucking answer. They can also write uteroplacental insufficiency. This causes what's referred to as late decels, late decelerations, where a transient bradycardia we get in the fetus is going to occur ever so slightly after the uterine contraction. So, in other words, if we were to draw a straight line between the zenith of uterine contraction and the nadir of a fetal decel, there would be a slight positive slope. Okay, they occur, the decelerations occur ever so slightly after the uterine contraction, late decels, where we said early decels, they're in the same y plane. So, for your uteroplacental insufficiency / fetal hypoxia, we have late decel. USMLE wants a triad of number 1, stop all oxytocin, number 2, give the woman oxygen, number 3, position her left lateral decubitus. Fetal hypoxia, wrong fucking answer. Choice C, fetal sleep state, wrong fucking answer. So fetal sleep state, we're going to have a straight line. We're not going to see any change in the fetal heart rate. And it's going to be within the normal range of 110 to 160. Wrong fucking answer. Choice D, fetal well-being, correct answer. So you need to know accelerations are just fetal well-being. It's what we expect on a non-stress test. This is called a reactive non-stress test, which means a normal / healthy non-stress test. An acceleration is going to be a transient increase in the fetal heart rate, about 20 beats per minute. It's going to last about 20 seconds, and you'll get 2 to 3 of these episodes per 20 minutes. Those are called accelerations. I don't know what to tell you, okay? If you're learning it for the first time, it sounds a little bit specific or weird. It's not. This is just like 101 level Obgyn, okay? And as I said, it can show up on the step 1 exam as per feedback I've received. So these are just accelerations. This is what we expect when we do a non-stress test. And there's no relation to uterine contractions. So let's just quickly hop to the final ones here. Maternal fever, wrong fucking answer. So this can be confused with fetal sleep state. So they're going to give you a straight line for the fetal heart rate, okay? But rather than being within the normal range of 110 to 160, they'll give it to you, let's say, at 190. And you're like, oh shit, like it's high, the heart rate, but it's a straight line. That's just maternal fever. Don't know what to tell you. Wrong fucking answer. Choice F, umbilical cord compression, wrong fucking answer. This causes what's referred to as variable decelerations, variable decels. So you're going to have no relationship between the uterine contractions and the episodes of fetal bradycardia. Okay, that's umbilical cord compression. So that they ask all of these on the USMLE. They want you to know that for umbilical cord compression, you're going to do the same triad that you do for late D cells. As I said, that's going to be stop all oxytocin, give oxygen, position the female, left lateral decubitus. In addition, you do amnio infusion. Okay, they ask that on the Obgyn form, where you're injecting sterile saline into the uterus. There's going to be rupture of membranes, they'll say, and you're going to inject sterile saline into the uterus, and that can help relieve the umbilical cord compression. So if you ever see that term, amnio infusion, you're like, that's weird. When do we do that? The answer is variable D cells. In this case, wrong fucking answer. You know the deal. To make more content. If you like my stuff, subscribe my channel. I appreciate your time. That's it.